Good day, everyone. The plane is ready to take off in a second. Brace yourself because we will going to find our way to multiple disabilities. Enjoy the trip. So according to the Individuals with Disabilities Education Act, multiple disabilities refers to concomitant impairments. But what do we mean by concomitant? So concomitant means it is occurring and existing at the same present of time. In other words, two or more impairment exist together in one person. It could be in the combination of cognitive problems, movement, or sensory. Moreover, the combination of these disabilities causes such severe educational needs that they cannot be accommodated in special education solely for one of the impairments. But thankfully, the U.S. federal government definition includes those who have more than one impairment. There are many combinations of disabilities, and I name some of them to give you examples of what really is multiple disabilities. And some of them are visual impairment plus mental retardation. So kaning mental retardation, this is currently known as intellectual disability. Mao ni siya ang term na gamiton when a person has certain limitations in cognitive functioning and skills, including communication, social, and most of all is self-care skills. These limitations can cause a child to develop and learn more slowly or differently unlike sa kanang typical developing child. So another example is the union of visual impairment, hearing impairment, and mental retardation. And the last one is cerebral palsy plus mental retardation with hearing, speech, or visual problems. So kaning CP, this is a group of disorders that affect a person's ability to move and maintain balance and posture. So this is the most common motor disability. So can you now imagine or visualize what is multiple disabilities? Indeed, makita jud nimo nga dili gyud lalim, not one, but two or more disabilities. Moving on, people with multiple disabilities have a combination of various disabilities that may include speech, physical mobility, learning, mental retardation, visual, hearing, brain injury, and possibly others. They may also have sensory losses and behavior or social problems. But perhaps the most significant characteristics of many people with multiple disabilities is deficits in the area of communication, making it difficult for them to communicate their wants, needs, and pains to those around them. But have you ever think unsay nakakos nganong nay magka multiple disabilities? In nearly half of the children born with multiple disabilities, actually there is no identifiable cause. But in the rest of the known causes, there are chromosomal abnormalities, developmental disorders of the brain, metabolic disorders, and negative prenatal environmental influences. Children ages 3 to 5 are considered to have multiple disabilities when they demonstrate concomitant cognitive, physical, or sensory impairments which results in severe delays in development. Children with multiple disabilities will typically share in 5 distinct areas of development: the intellectual functioning, adaptive skills, motor skills, sensory functioning, and communication skills. However, ang sintomas gani ani nga disability can often be uncertain or undetermined. It's because some students with multiple disabilities can also have average or even above average intelligence. Let's just keep in mind that the common connection between students in this category is not just that they have two or more coexisting impairments, but that they generally need extensive support across many skill areas. And speaking of extensive support, I enumerated some common educational challenges associated with students with multiple disabilities. First, the learner's ability to effectively communicate with peers, teachers, and support staff. Second, putting in place a setting that best suits the learner's intelligence level. Third, assessing the learner for visual and hearing challenges. And last is the student's overall ability to function in the classroom. So indeed, disabilities can cause numerous learning challenges.
Okay, so since we already know the definition, the types, the characteristics, and symptoms of multiple disabilities, let us now continue our discussion. So now, let us understand the role and involvement of the families of individuals with multiple disabilities. Families raising young children diagnosed with multiple disabilities encounter experiences that are often unique and extend well beyond the early childhood years due to the intensity and severity of their child's needs. So, makaingon jud tanon that families with children having multiple disabilities really do face a lot of challenges because ang ilang needs are very different than of a normal child. They require more attention and frequent medical testings and equipments, and so on. Thus, the context of these families must be understood in order to provide meaningful services and support. Families can be the most essential factor in a child's success in reaching his or her potential. Thus, it is important for them to encourage the children to take part in the family. So, family involvement is very important because when children are a part of family life, they learn about the world around them, about the people in that world, and of course, about themselves as well. Okay, so families often collaborate with professionals to facilitate meaningful engagement for their child and multiple disabilities across all environments. So, families with children having multiple disabilities are often assisted by professionals, especially those having extreme multiple disabilities. These families frequently interact with formal supports to meet their young child's developmental needs. Families raising young children with multiple disabilities often rely on informal support such as extended family members, friends, and community members. Many families of children with multiple disabilities often find that it is a challenge to involve their children socially with others their age. As children get older, the gap between them and typically developing children can become greater and add to the social challenges involved. The social success of the children must be planned early. Just like what I've said earlier, it is encouraged that the child must be involved in the family. They can play games or interact as much as possible, just for them to have more social experiences. Early intervention and early diagnosis are the keys to treating children with multiple disabilities. For early childhood years, services and supports are both child and family-centered and holistic. So these may include infant simulation programs that aims to provoke sensory, cognitive, physical responses that help newborns connect with their environment. So next, during the preschool years, family involvement must be given continuous emphasis. So the goal here is to maximize social communication, motor skills, cognitive skills, self-care, and play of the child. And during elementary school years, a child's independence level both in the community and at home must be enhanced. So, mao ni siya no self-determination. There must also be a positive relationships with parents and family members. Effective educational programs focuses on function skills. And lastly, assistive technology. So assistive technology is used to increase maintain, or improve the functional capabilities of students with multiple disabilities. So here, there will be a major transition from elementary years to adolescent years. So these are the important goals for transitioning for adult life. First, establish a network of friends and allies. Develop the ability to use community resources on a regular basis. Secure a paid job that supports the use of community resources and interactions with peers. And lastly, establish independence in making lifestyle decisions. So now, let us move on to the treatments. So technically, there is no treatment or cure for these abilities, but they can be minimized or lessened using early interventions. So most children with multiple disabilities will need some level of help and support throughout their lives. How much support a child needs will depend on the disabilities involved. So a child with mild multiple disabilities may only need intermittent support, meaning the support is needed every now and then or for particular tasks, while children with multiple or more severe disabilities are most likely to need ongoing support. For children with multiple disabilities, physical and occupational therapy can help ease physical challenges, and this could help a child's ability to function at school. Assistive technology, braille, hearing aids, and sign language can be used to assist their communication problems and hearing and visual impairments. Handheld personal computers with touch screens and audio and visual information containing messages and instructions can be particularly helpful for children with motor control issues. So a closer look at the specific disability categories which comprise a student's multiple disabilities can supply further suggestions for overcoming challenges. These treatments may vary from disability to disability. Most children with multiple disabilities will need some level of support and assistance throughout their lives, and the amount of help a child needs would depend on the disabilities involved. Okay, so now we have here an example of a person with multiple disabilities, and he's quite prominent by the way. So here we have Stephen Hawking. He was regarded as one of the most brilliant theoretical physicists in history. He dedicated his life to searching for the origins and structure of the universe, from the Big Bang to the black holes. So he was diagnosed with amyotrophic lateral sclerosis, or also known as ALS. So ALS is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, causing the loss of muscle control. ALS affects the nerve cells involved in voluntary muscles movement, decreasing a person's ability to move and speak over time. The degeneration of motor neurons in his brain interferes with messages to muscles in the body. Eventually, muscle atrophy and voluntary control of muscles are lost. Stephen Hawking lost his ability to speak and control his body. He uses assistive technology to compensate for mobility and speech difficulties. He died on March 14, 2018 at the age of 76. Okay, so moving on. So we have here a documentary featuring a child having severe and extreme multiple disability. So if you can find time, you can visit the link and view the documentary yourself. Okay, so before we end our discussion, let me leave you a quote from the Dalai Lama. Be kind whenever possible. It is always possible. So thank you very much for listening, and I hope that you have learned something today. Thank you.